You want to feel your best as you get older, full of energy, sharp in your mind, able to enjoy life without aches and worries holding you back. And maybe you've looked at supplements as a way to help achieve that. Right. Those bottles on the shelf promise all sorts of benefits. Better joints, sharper memory, more vitality. It's easy to think they're harmless, just extra goodness for your body. But here's a surprising, even painful truth that many people over 60 discover too late: some of the most popular supplements, the ones that seem completely safe, can actually cause serious problems if you're not careful. Because as we age, our bodies change, how we absorb things changes, how we process medications changes, and even how supplements interact with each other and with prescriptions becomes much more complicated. What was fine in your 40s or 50s might not be okay now. Taking the wrong thing, or even the right thing in the wrong amount, can interfere with vital medications you're taking, worsen existing health conditions you might have, or lead to unexpected and unpleasant side effects. It's like trying to navigate a complex map without reading the legend. You could end up going in the wrong direction or even hitting a dead end. In this video, we're going to talk about 3 specific supplements that many people over 60 take, but which you absolutely should never take without having a conversation with your doctor first. They aren't necessarily bad, but they carry risks that are much higher for our age group. Risks you need to be aware of. Stay with me until the very end, because understanding this is truly critical for your health and safety. It might just surprise you how much of a difference a simple conversation can make. Let's dive right in with the first one, a really common one that many people swear by, and that's fish oil or omega-3 fatty acid supplements. You see ads for them everywhere. Hear about their benefits for heart health, brain function, joint pain, even eye health. And yes, omega-3s, particularly EPA and DHA found in fish oil, are essential fats that play many important roles in the body. Getting enough of them from sources like fatty fish is generally a good thing for people of all ages. But popping a high-dose fish oil capsule, or taking multiple capsules every day without discussing it with your doctor, especially when you're over 60, can introduce some significant risks that you absolutely need to consider. The primary concern with fish oil, especially at higher doses often found in supplements, is its effect on blood clotting. Omega-3s can have a mild blood thinning effect. Now, for some people, this might sound like a benefit, particularly if they're worried about blood clots. But if you are already taking prescription blood thinning medications, and many people over 60 are, think of medications like warfarin, which goes by brand names like Coumadin and Jantoven, or the newer direct oral anticoagulants like Rivaroxaban sold as Xarelto, Apixaban as Eliquis, Dabigatran as Pradaxa, or Adoxaban as Savaiza. Adding a high dose of fish oil on top of that can significantly increase your risk of bleeding. This isn't just a small risk, it can be serious. Imagine needing surgery, even something routine, and having an increased risk of complications because your blood isn't clotting properly. Even combining high-dose fish oil with other common medications that can affect bleeding, like aspirin or non-steroidal anti-inflammatory drugs, NSAIDs such as ibuprofen sold as Advil and Motrin, or naproxen sold as Aleve, can be risky. Many people over 60 take aspirin daily for heart protection or use NSAIDs for arthritis pain. Adding fish oil into that mix could lead to excessive bruising, nosebleeds, or even more serious internal bleeding. Your doctor needs to know every single medication, prescription or over-the-counter, that you are taking, along with any supplements. Before you start a fish oil supplement, they need to assess your individual bleeding risk based on your medical history, your other health conditions, and all the medications you're on. They can help determine if fish oil is even safe for you. And if so, what the appropriate dosage would be. Taking too much can also cause digestive issues like burping, indigestion, or diarrhea, which, while not life-threatening, can be uncomfortable and disruptive, especially if you already have a sensitive stomach or conditions like irritable bowel syndrome. Another point is the source and quality of the fish oil. Supplements aren't as tightly regulated as prescription drugs. The amount of omega-3s can vary, and some lower quality products might contain contaminants like mercury or PCBs, which are particularly harmful to older adults. Your doctor or a registered dietitian can advise you on reputable brands and appropriate dosages based on your specific needs and health status. They might even recommend simply increasing your intake of fatty fish, like salmon, mackerel, and sardines, a couple of times a week instead of taking a supplement, as food sources provide other nutrients as well and carry less risk of excessive dosing. The key takeaway here is that while omega-3s from fish are beneficial, the concentrated, high doses found in supplements are potent and interact with your body in ways that can be risky, especially when combined with other common medications or health conditions prevalent in the over 60 age group. Never just grab a bottle of fish oil because you heard it's good for you. Always discuss it with your doctor or pharmacist first, laying out your full medical picture and current medication list. This simple step could literally save you from serious complications. It's about making informed decisions about your health. Partnering with your healthcare provider to ensure everything you're taking is working together for your benefit, not against it. It's really crucial. This communication. Moving on from that, let's talk about another supplement that's incredibly common, especially among older adults concerned about bone health, and that's calcium. It seems straightforward. Right. We know calcium is essential for strong bones, and as we age, bone density can decrease, increasing the risk of fractures. So, taking a calcium supplement seems like a logical step to prevent osteoporosis and keep our skeletons strong. And for some people, a calcium supplement might indeed be necessary, especially if they don't get enough from their diet. But like fish oil, calcium supplements, especially when taken in high doses or without proper medical oversight, can pose risks that are particularly relevant for those over 60. One common issue, which might seem minor but can be very uncomfortable, is digestive side effects like constipation. Some forms of calcium supplements, like calcium carbonate, are more likely to cause this. But beyond discomfort, there are more significant concerns. Taking too much calcium, either through high-dose supplements or combined with a high-calcium diet, can lead to a condition called hypercalcemia, which means you have too much calcium in your blood. Symptoms of hypercalcemia can range from mild ones like nausea, vomiting, constipation, and fatigue, to more severe issues like kidney stones, kidney damage, confusion, and even heart rhythm problems. Your kidneys are responsible for filtering excess calcium from your blood, and as we age, kidney function can naturally decline in some individuals, making it harder for the body to handle a sudden influx of calcium from supplements. This is why it's so important to get your calcium levels checked and discuss your overall calcium intake from both food and potential supplements with your doctor. They can help determine if you even need a supplement, and if so, what dose is appropriate and which form might be best for you. But the risks don't stop there. Calcium supplements can also interfere with the absorption of certain medications, making them less effective. This includes common medications like thyroid hormone drugs, such as levothyroxine sold as Synthroid or Levoxil, certain antibiotics like tetracyclines and fluoroquinolones, and even medications for osteoporosis like bisphosphonates. To avoid this, it's often recommended to take calcium supplements at a different time of day than these medications. But the timing can be tricky to manage, especially if you're taking multiple pills throughout the day. Your doctor or pharmacist can give you specific guidance on scheduling your medications and supplements to minimize interactions. Furthermore, there has been some debate and research over the years linking calcium supplements but not dietary calcium to an increased risk of heart problems, including heart attacks. While the evidence is not entirely conclusive and studies have had mixed results, it's a concern that warrants caution, especially for individuals with existing heart disease or risk factors. The theory is that large doses of calcium from supplements might not be absorbed and incorporated into bones as efficiently as calcium from food, leading to calcium deposits in soft tissues, including arteries. Again, this highlights the importance of discussing calcium supplementation with your doctor, who can weigh your individual risk factors and help you decide if a supplement is necessary and safe for you. Often, increasing dietary sources of calcium, like dairy products, leafy greens, fortified foods, along with adequate vitamin D intake, which is necessary for calcium absorption and weight-bearing exercise, are the preferred methods for maintaining bone health. Supplements should really only be considered when dietary intake is insufficient. And that determination is best made in consultation with your healthcare provider. It's never a one-size-fits-all situation, and what works for one person might not be right or safe for another. Taking the time to talk it through with your doctor ensures you're making the safest choice for your unique body and health profile. Don't just assume because it's good for bones that more is always better, or that a supplement is the only or best answer. Your doctor's guidance is invaluable here. Now, let's move on to the third supplement we need to talk about. And this one is particularly tricky because it's an herbal supplement, often thought of as very natural and therefore harmless. I'm talking about St. John's wort. You might have heard of it as a natural remedy for improving mood, easing symptoms of mild depression, or reducing anxiety. And it's true that some studies suggest it can be helpful for mild to moderate depression, comparable in effectiveness to some prescription antidepressants, but with potentially fewer side effects for some people. However, the critical issue with St. John's wort, especially for anyone over 60, or frankly anyone taking any prescription medications, is its incredibly powerful and widespread interactions with a vast number of drugs. This is not a minor interaction. It can be seriously dangerous. St. John's wort affects liver enzymes and transporter proteins in your body that are responsible for processing and eliminating many medications. This means it can either speed up the breakdown of a drug, making it less effective, or slow it down, leading to higher levels of the drug in your system and increasing the risk of side effects or toxicity. Think about the medications commonly taken by people over 60 medications for heart conditions, blood pressure, cholesterol, blood thinners, antidepressants, anti-anxiety medications, seizure medications, HIV drugs, transplant medications, birth control pills, and even some chemotherapy drugs. St. John's wort can interfere with almost all of these classes of drugs, and many others besides. For example, if you're taking a blood thinner like warfarin, St. John's wort can make it less effective, increasing your risk of blood clots. If you're taking certain antidepressants, combining them with St. John's wort can lead to a potentially life-threatening condition called serotonin syndrome, which causes symptoms like confusion, rapid heartbeat, high blood pressure, muscle rigidity, and fever. It can make medications for high blood pressure less effective, putting you at higher risk of stroke or heart attack. It can reduce the effectiveness of medications that prevent organ rejection in transplant patients, potentially leading to organ failure. It can even reduce the effectiveness of chemotherapy drugs, hindering cancer treatment because its effects on these enzymes and transporters are so broad. It's incredibly difficult to predict exactly how it will interact with your specific combination of medications without professional guidance. Many doctors and pharmacists strongly advise against using St. John's wort at all if you are on any prescription medication, precisely because the risk of a dangerous interaction is so high and affects so many common drugs. Another concern with St. John's wort is that it can increase your sensitivity to sunlight, making you more prone to sunburn, especially if you're already taking other medications that have a similar side effect. While it might be appealing to try a natural approach for mood, the potential for severe drug interactions makes St. John's wort one of the riskiest supplements for anyone on medication, which includes a large portion of the population over 60. This is a perfect example of why natural does not equal safe, and why discussing all supplements, including herbal ones, with your doctor or pharmacist is absolutely non-negotiable, especially as you get older and are more likely to be managing multiple health conditions with multiple medications. They have the knowledge to check for potential interactions based on your complete medication profile and health history, something you simply cannot do safely on your own with a quick internet search or advice from a friend. Don't take chances with your health when it comes to something that can have such far-reaching effects on critical medications. Always ask your doctor first. So, we've talked about fish oil, calcium, and St. John's wort, 3 common supplements that carry specific, heightened risks for people over 60 primarily because of potential interactions with medications, effects on existing health conditions, and changes in how our bodies process things as we age. It really boils down to this. While supplements can sometimes play a role in supporting your health, they are not simple vitamins like the ones in your daily multivitamin. They are potent substances that interact with your body's chemistry and can significantly impact how prescription and even over-the-counter medications work. As we get older, we are more likely to have chronic health conditions and be taking multiple medications to manage them. This combination creates a complex landscape where adding a supplement without professional advice is like throwing an unknown variable into a delicate equation. A supplement that might be fine for a younger, healthier person with no medications could be dangerous for you. The risks of bleeding with fish oil, the potential for too much calcium affecting your kidneys or heart, or interfering with crucial medications, and the massive drug interaction potential of St. John's wort are just 3 examples. But the principle applies to many others as well. Herbal supplements, high-dose single vitamins or minerals, even combinations of supplements can all have unforeseen consequences. Your doctor isn't just there to prescribe medications. They are your partner in managing your overall health. They know your medical history. They know all the medications you are currently taking, hopefully because you keep them fully informed. And they understand how aging affects your body's ability to handle various substances. This puts them in the best position to advise you on whether a particular supplement is safe and appropriate for you, what dosage you should take, and how it might interact with your existing treatment plan. They can help you identify potential risks before they become problems. Sometimes, the best approach isn't a supplement at all, but rather adjustments to your diet, lifestyle changes, or focusing on getting nutrients from whole foods whenever possible. For example, instead of a calcium supplement, could you increase your intake of leafy greens, fortified foods, or dairy? Instead of high-dose fish oil capsules, could you incorporate more fatty fish into your meals? Sometimes, the answer might involve testing, like checking your vitamin D or calcium levels before recommending a supplement. To ensure you actually need it and to determine the right amount, open communication with your healthcare provider about everything you are taking, including all vitamins, minerals, herbals, and other supplements, is absolutely essential for your safety and well-being, especially as you navigate the changes that come with being over 60. Don't hesitate to bring your supplement bottles to your next appointment and ask questions. Your doctor wants to help you stay healthy and safe. Taking proactive steps like this empowers you to make the best decisions for your unique health needs. Remember, small changes and informed choices, like simply talking to your doctor before starting a new supplement, can make a truly significant difference in your health and happiness as you get older. We all want to live our best lives at every age, and part of doing that is being smart and safe about what we put into our bodies. If you found this information helpful, please let me know in the comments below. Have you had an experience with a supplement you later learned was risky? Share your story. It might help others. Also, please give this video a like if you found it valuable and consider subscribing to my channel. That way, you won't miss out on future videos filled with practical tips and important information to help you live your best life over 60. Keep taking care of yourself, keep asking questions, and keep partnering with your doctor. Here's to your health and happiness.